Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. In April 2024, a new federal rule requiring minimum staffing levels in nursing homes was released. This rule is an important step toward improving quality conditions in nursing homes and ensuring that residents receive the care they need. Listen in on a discussion between Consumer Voice's Lori Smetanka and Sam Brooks, who talk about the importance of the rule, what it says, and how we can start thinking about using it in advocating for quality care.
Hello, everyone, and thanks for joining today's episode of Pursuing Quality Long-Term Care. I'm Lori Smetanka, Executive Director at the National Consumer Voice for Quality Long-Term Care, and I have joining me today Sam Brooks, our Director of Public Policy, and we are going to be talking about the newly released federal minimum staffing standard that came out recently from the Center for Medicare and Medicaid Services. Hi, Sam. How you doing
Hi,
today?
Lori. How are you? Nice to see you.
Good. Nice to see you. It's been ages, right?
Too long. Too
Too
long.
long. Too long. So thanks for joining me to talk about this new important rule. So for a little bit of background for folks that are listening, this is a long-awaited final staffing rule. It's something that our listeners know that we've been advocating for quite a long time. It's been sorely needed for decades. And after about 2 years ago now, the president had released a set of proposals for improving quality in nursing home care, and in requiring minimum staffing standards was one of the elements of those proposals. And after a 2 year process, which included a request for information, where the public was able to provide and respond to questions that the administration had put out in Consumer Voice, and many of our listeners responded to that. They also undertook a study looking at minimum standards and what the need was for those. And they also put out a formal comment period in the Federal Register, which is something that's required, where they had posted proposed rules, and folks were given an opportunity to comment that. And they had more than 46,000 comments that they had to review. So this process, which has been going on for 2 years, came to an end a few weeks ago when in April, CMS, the Centers for Medicare and Medicaid Services, released this long awaited final rule. And so it's something that we wanted to talk to you about there. And so, Sam, you've been kind of leading the charge here at the Consumer Voice in terms of going through and looking at the rule. And just as a general overview for our listeners, what are your impressions of what we're seeing in the rule, and why is it important?
Well, overall, I mean, as you said, a lot of folks offered comments. I mean, there was 14,000 comments, with overwhelming support for the standard. We offered certain comments and recommendations. This rule doesn't meet those recommendations, but we see it as an important first step. Critically, this is a minimum staffing standard. It is not a maximum, so it's designed to address the basic needs of residents. So each resident should be getting at least this amount of care. And CMS makes it clear throughout the rule that this is just that, a minimum, a basement. In fact, most nursing home residents are going to require more care than that. In fact, the standard, the total standard, which we'll go over, of 3.48 hours per resident day, it's about 3.5 hours. Is less than the national average now. So it's a very modest standard. It's really designed to bring up the really poor performing homes, the lowest performing homes. And so we certainly support it, but we acknowledge that this is a floor, and many residents, depending on their care needs, are going to need a lot more. They're one of the really positive things in this rule is that it implements a requirement that a nursing home have an RN 24 hours a day, 7 days a week, which is so important and critical, and something that Consumer Voice and other advocates have fought for such a long time. RNs play a critical role in nursing homes, and for the current requirement was only 8 hours per day. So there was 16 hours potentially each day that a nursing home wouldn't have an RN overseeing the care. So that's one of the really shining points of the rule. It's a complicated rule, it's phased in over time.
Mhm.
I'm happy to walk us through it. And I think try to break it down into the most basic parts,
Yeah.
and try not to overwhelm folks with too much information.
Right. Yeah, definitely. As you said, it's this is a floor, a baseline, a floor below which you can't go. That's something that we have argued for a long time because we know that there have been really wide variations and extremely poor staffing in too many nursing homes across the country for far too long. And while we certainly will continue to advocate for the necessary staff that people need, it's important that we at least have this baseline and can start raising the bar for the nursing homes so that all residents can ultimately receive quality care. So absolutely, let's start walking through the provisions of it. And the biggest part is, as you said, that it does require this minimum requirement for hours per resident day. And so let's start walking us through some of the different provisions, and let's start with that. So there's a total standard, right?
Yeah, so there's a total standard that needs, and that is 3.48 hours per resident day. And it's going to be a little confusing because that goes into effect first, which means in 2 years, the 3.48 will be in place in urban areas, and then 3 years it will be in rural areas, and those are areas defined by the Census Bureau. The when the rule is fully implemented, there will need to be specific elements, elements met within that number. What I mean is that 3.48 can be composed of RNs, CNAs, and licensed practical nurses. However, once the rule is fully implemented, there will be certain baselines that need to be met. And the first one will be that each resident gets 2.45 hours per resident day of CNA care. And that goes into effect. It's going to be strange for a little bit. That goes into effect after the total standard. And then the other component is 0.55 hours of RN care per day. So that adds up to three. We still need to get to that 0.48. And CMS has given facilities the flexibility to get to that 0.48. They could use LPNs, they could use RNs. We hope that they use more licensed nursing, RNs and LPNs. But they're giving them what they call regulatory flexibility. There is no requirement for LPNs. The only two requirements when the rule is implemented that must be met are those RN and CNA numbers. So it's a bit confusing. The 3.48 goes into effect first, and then those other two components go into effect later. So at the third year for urban areas and at the fifth year for rural areas, those two components of the RN and CNA numbers will go into effect.
Mhm. So part of the importance of that in terms of the total number going into effect first is, as you alluded to earlier, in the fact that there's not as many registered nurses in nursing homes. We do see that there are a higher number of licensed practical nurses, licensed vocational nurses than
Yeah.
registered nurses in nursing homes. And part of this rule is designed to increase the number of registered nurses that are going to be working in nursing homes. That's not to say we want to exclude the LPNs and the LVNs. We hope that facilities will continue to keep those nurses on staff in order to just kind of continue raising the bar. But we will start to see an increase as this rule gets implemented, particularly as the specific requirements for registered nurses goes into effect. We should start seeing more registered nurses in nursing homes.
And that's going to be the most profound effect that you'll see. You're going to see a significant reduction in the ratio of residents to RNs. Just a little incremental bump with that RN number really brings it up. So that there'll be the most pronounced difference should be with increased presence of RNs. And as you alluded to, we're a bit concerned as when the full standard goes into effect, there's no requirement that they maintain the status quo. So we imagine for a lot of nursing homes, there'll be some jiggering with the current numbers, maybe reducing LPNs and hiring CNAs. So the strange thing is for this is this actually might save nursing homes money if they do things like that. We hope they don't, but we know the industry does seek out ways to save money. So yeah, it's going to be. We want to see that increase in the registered nursing is going to be very, very important, and we see such a significant. For instance, during COVID, there was one study that showed, I think, a 22-minute increase in RN significantly reduced COVID numbers and deaths. So there's really a profound difference in care quality just with an incremental bump on RNs. So
Mhm.
that's going to be great. And it's going to be around the clock too. There's going to be
Mhm.
an RN there present. So we really feel like that will make a big impact on resident health outcomes.
Absolutely. And as we're looking at this, and again, we mentioned that this is a floor or a baseline, and so before this standard went into effect, the only standard for staffing in nursing homes was that there be sufficient staff to meet the needs of the residents in order to ensure safety and for them to attain or maintain their highest practicable levels of well-being. That still is in existence. That
Yeah.
requirement is still is in existence for sufficient staff, which is why we talk about this as being a floor or a baseline, because facilities are still required to assess what the needs are for all the residents in their long-term care facility, and to determine what skill sets and what competencies or what training or what skills the staff need to have in order to best meet the needs of the residents. And so we should be seeing not every facility just at this bottom number. We should be seeing many facilities that particularly have higher acuity residents or residents with higher needs to have more staff on hand,
Yeah, and
right?
that's so important. I mean, I think exactly. I mean, essentially, it's almost a continuation of the current regulation. There still needs to be sufficient staff, but um, you there you can't go below this 3.48 and meet those components. So you're absolutely right. And it's frustrating. I mean, we'll talk a little bit about it as we go on. It's CMS throughout the rule talks about staffing to acuity and staffing, which means, meeting the residents' needs, but there's not a lot of guidance on that. So
Mhm.
Consumer Voice is going to be working very, very hard and over the next months and up and leading up to implementation to try to provide some models for that. So
Mhm.
residents are assured that they're getting the care they need. Because again, um, this is a bottom.
Sure.
It's not a ceiling.
And so, one of the ways that facilities are required to determine the needs of the residents certainly is as they assess the needs for those residents, they develop their care plans, but then they are required to do what's called a facility assessment, so that process is what a nursing home is required to use to determine what resources, what staff, what skill levels are necessary for a facility to care for its residents, and then to have those resources, staff, skills on site and available in order to provide the care. And that's a requirement that's been in effect actually for a few years now. The last time CMS overhauled its nursing home regulations, it put in place a requirement for this facility assessment. So nursing homes should already be doing it. This new rule has a few different additions and requirements related to that. One of which is that they are to engage multiple staff in the development of it, including physicians and nurses and others who touch on patient care and the needs of the residents. But they're also to solicit input from residents and their representatives and family members in the development of this facility assessment. So while it is something that the facility needs to do. It is something that I think residents and families and advocates need to be aware of, that this process is supposed to be happening on an annual basis at least, if not more frequently, in order to determine what are the appropriate staffing levels in the nursing home.
And I think, even going beyond that too a little, I mean, these nursing homes are required to assess the needs of all their residents, and they submit data to CMS in order to get paid. So the nursing homes generally know how much care a resident needs. So they can, having a model, for instance, in our comments, there was a model suggested by Charlene Harrington in a great paper from 2020, breaking down how much care certain residents would need based on their, on their care needs. And that's the model we need to be moving towards, is several minimum standards based on the needs. Because trust me, nursing homes know the care needs, the needs of the residents. It's about prescribing to those levels of care, a certain amount of care. So hopefully that's, the facility assessment, and down the long run, we should be able to even get more precise with staffing to meet residents' needs as
Mm-hmm.
best as we can. I mean, nothing's
Mm-hmm.
perfect, right? I mean, each
Right.
resident is individual. This isn't a one size fits all. But generally, we're dealing with a lot of the similar conditions, and we know what those needs often are for those types of residents.
Absolutely. And I'm glad you said the one size fits all, because that's been one of the pushbacks
Oh
from the
yeah.
nursing home industry, is that this minimum standard actually is a one size fits all standard for nursing homes. And that's not the case at all. The
Yeah.
fact of the matter is that this standard is a minimum or a baseline, and that the facility assessment, which is looking at what the actual needs are of the resident and how a facility needs to meet those needs and what resources they have available, that helps determine what the actual staffing level should be in that nursing home. And so it needs to be individualized for each nursing home based on the types of residents and what their needs are that are living there. So this is not a one size fits all
Yeah. It's a
rule.
completely disingenuous argument, and they know it's disingenuous because CMS says throughout it that it isn't. This is a baseline,
Yeah.
and that residents' personal needs need to be met. And nevertheless, I think it's an effective argument for the public, for folks who just don't quite know. But they've already filed a lawsuit in a court in Texas, a federal lawsuit, and that's one size fits all is before every mention of the minimum staffing standard. So I think they've determined that this is effective messaging, despite the fact that it's not true. And it's actually the opposite.
Mm,
Really putting the focus on residents as long as we're meeting this minimum standard. So,
absolutely.
right.
Yeah. So one of the other challenges that the nursing home industry has been putting up is that we can't meet a standard like this because there aren't enough people, there aren't enough
Hmm.
staff, available. And so CMS tried to address that by including some waivers and exemptions in this rule. Now, some of the waivers related to licensed nursing actually currently exist in the nursing home reform law, so they needed to be carried over. But then some exemptions from the minimum staffing standard have also been included, and in certain circumstances, facilities may become eligible for a waiver or an exemption from these requirements for a period of time. So let's talk a little bit about them, and so that we can try to help people understand what may happen here.
More complicated. And I think when doing our summary, and it was the most meaty part of the summary because, as you said, there was pre-existing exemptions, and they created a whole new set of exemptions. But yes, I mean, CMS, the industry was very effective in scaring and applying pressure to CMS. So they've built a waiver and a hardship exemption system here that really will likely provide thousands of homes with exemptions and waivers from the the new standard. There, it's broken down. As you noted, there's statutory, which means they're in law, so they can't be changed by regulation. So some, if not all, of the RN requirements will be able to be waived. And similar for the new total staffing requirement as well. The waivers are based on a variety of things, including location, the availability of staff, good faith efforts to hire, um, and some other issues. You can read our summary to get a better hold on it. But there's going to be numerous opportunities for facilities to obtain a waiver. And unfortunately, I mean, we were very strong against the waivers. We don't think one nursing home resident should get more care than another. But these waivers are can go on forever. They go on for a year, and then they can be renewed. There are some good things well, they have built in some good things into the waivers. Facilities that are special focus facility cannot get a waiver. Facilities that have been cited for certain violations at a heightened level cannot be get a waiver, and facilities that haven't submitted accurate payroll data. And importantly, to get a waiver, facilities will have to provide notice, and that notice will have to be public. It'll have to be posted publicly in the facility. Notice will have to be given to current and prospective residents and to the long-term care ombudsman. And CMS indicated in the rule that they will also be posting it on Care Compare. So we're hopeful that kind of badge of dishonor will incentivize facilities to properly staff. So when people go to Care Compare and see an icon that says this facility isn't staffing correctly, they'll know. So there's going to be a complex set of waivers. We're concerned about them. I mean, they're intensive, lots of information, and we're concerned that CMS just doesn't have the capacity to properly assess eligibility for them. So we want to make sure that this doesn't just become a checkbox thing. Yes,
Mhm.
you're located in a certain area. Yes, you made good faith efforts to hire. We want to make sure that these are just very small a number of exceptions, because we don't want to
Mhm.
create disparities in outcomes, because we often know who disparities fall on,
Mhm.
low income folks, people of color. And so while the irony here is the industry, this one size fits all, and there's not enough workers. If that's true in a certain location, more likely than not, a facility is going to get a waiver. This isn't going to cause them to shut down. CMS has been overly generous with the exemption process, and those nursing homes that really are making good faith efforts are trying to hire folks and are trying to provide good care are more than likely going to get an exception. Whether you and I agree with that or not is another
Right.
thing, but it's really a red herring. I mean, CMS, estimates thousands of homes will qualify for these.
Mhm.
It's a concern for us, but again, it's another disingenuous argument by the industry to try to derail the implementation of this rule.
Right. And I mean, I think, another piece for me when I think about these waivers, one is that, for those nursing homes that, may be in areas where they currently may have some challenges in attracting staff, or are already thinking, well, we're just going to wait and apply for the waiver. I think that's the wrong approach. I mean, they need to start planning
Right.
now
Exactly.
for how they're going to meet this standard. One element that they could be starting to look at immediately and working on is working on reducing turnover in their nursing home and looking at how they can ensure that people are wanting to stay, that they're improving the job quality, so that they don't have a big turnover of staff. as well as looking at their recruitment processes for bringing people in, looking at, people that may have left the industry during the pandemic. How can you entice them to come back, to work? But certainly waiting to meet the standard at the last minute is not the right approach, and so nursing homes should not be waiting. The other piece about this for me is that the fact that there are requirements with respect to sharing with residents and families, sharing with ombudsmen, and publicly having to post that there are waivers. Those are opportunities for advocacy and discussion with the nursing home. So if you do get a notice that your facility has a waiver, you can be asking questions about it. How are you ensuring quality care? What are you doing to ensure that you can attract staff and bring in the people so that we are actually meeting the needs of the residents? And what processes are you having in place to protect the safety and well-being of residents now if you don't have these minimum levels? And all of that is required in the rule, but it's things that ombudsmen, other advocates, and families and residents can be asking the nursing home and opening up conversations about.
Yeah, that was one of our when we were commenting on this rule. One of our we said, we don't want any waivers, but if they have to be, I mean, you need to make these substantive. And you don't, what are you, what wages are you offering for jobs? What is the turnover? I mean, the average turnover in a nursing home in the United States is 52%. That means and that's direct care staff. So every other worker is being replaced each year. That's a job quality crisis. It's not that there's people that don't want to work, they just don't want these jobs. And there should have been some effort here to say, what are you doing to improve jobs and in order to address this issue? Because it's an equity argument too for workers. Because when money isn't spent on care, it's because it's not paid to workers. And when a CNA wage is $17 an hour, that's just not going to incentivize folks to come work there. So there's this real kind of sympathy to the industry when it comes to the job issue, but there's no real honesty about it in a way, in that this is mostly a catastrophe created by an industry that just doesn't pay its workers well, and places profits over workers. So again, we didn't want waivers, but we did want more robust waivers. And so residents are going to have to be very astute because they're not even banning new admissions. So they could give you a notice, and that facility is still going to allow admit residents, and in fact, making the problem worse. So, as you know, Lori, you and I have talked, we're going to really need to do some education for residents to make sure that they know what's going on. And if they want to move to another facility, they shouldn't have to. This is their home, but it's just unfair. Imagine if
Mm-hmm.
you were in your home and someone said, we're not going to give you as much services as your neighbor.
Mm-hmm.
And it's just very discouraging. So it's going to be a lot of opportunity for us to really advocate strongly to ensure that these are they're very rare, and when they are implemented, that the precautions are taken to protect the residents that are in that home.
Absolutely. So let's just kind of look at timelines for a second. As you
Sure.
mentioned, the 3.48 hours per resident day, which is the total minimum standard, goes into effect first. So that happens when, Sam?
So that happens, that and the 24/7 RN occur first. For rural areas, it's 3 years, and for urban areas, it's 2 years. And they're basing that, as I said earlier, on the US Census. So you could put in your zip code in the United States Census and figure out if you're in a rural area. Um, the facility assessment, which we talked about, actually goes in 90 days. So that will be in sometime in September, where those requirements are made. So those things will come into effect first in the urban areas, and then second in the rural areas. And then
Mhm.
the other two requirements, the 2.45, CNA per day and the 0.55 hours per day of RN care will go in third year in the urban areas and fifth year in rural areas.
Mhm. Okay, so it's something that, again, people can start talking to their facilities about. How are you going to be working to meet the standard? Are you working on your facility assessment? The 3.48 goes into effect in 2 years in urban areas, 3 years in rural areas, and then a year or two after that, the more specificity goes into effect. So it is something that people need to be prepared for, but not waiting to comply with.
Right.
Residents and families and advocates certainly should be encouraging nursing homes to comply with at least this minimum, and certainly to meet the needs of the residents as required based on a facility assessment. And they should be asking how they can get involved in that assessment process, and contribute to that. So that's, certainly an important advocacy point as
Right.
well.
It's a great way to point it. It doesn't mean that in 2 years everyone's care needs are going to suddenly appear. They're there now, right?
Right.
Most residents need more than 3.48 now. And so that's a great way to put it, is that you need to be complying now. I mean, to wait 5 years, it would just be devastating to residents.
Right.
And as you said, that this needs to be an advocacy tool for residents, families, workers, the folks who really are on the front line, ombudsman too.
Mhm. Well, and people can certainly already be getting a picture of what staffing looks like in their nursing homes, even today. They can go to the Nursing Home Care Compare website to get information, put in their zip code and the name
Yeah,
of their nursing home, and they can get what the staffing information is today and currently, based on the latest reports to CMS. And every nursing home is required to post by shift the staff that are working and available. And that is supposed to be posted in a publicly available place.
right.
And so you can certainly ask your nursing home for that today. Where is it? Where is the posting of the staff that are available today? And so those are things that you can start looking at. Um,
So,
there's another piece of this rule, which is related, and it goes to Medicaid transparency. And while it doesn't affect, necessarily the numbers that we're talking about here and the staff that are on site, this does go to how money is spent and whether it's spent on staffing or on other issues. And so this rule also included some language with respect to requiring states to report what percentage of Medicaid payments are spent on compensation for direct care workers and support staff in nursing homes. And so that's a new requirement. It's something that we've been advocating for transparency across the board with respect to how Medicare and Medicaid dollars are being spent. And this is a step that CMS is now required in this rule. So any comment on that and why this is important, Sam?
no, I think it's an important first step. I mean, if anyone who's, spends time in this space, the constant chorus from the industry is we don't get enough money from Medicaid. It's just they've repeated it enough that everyone just accepts it. Yet we really don't have any proof of that. There's such a lack of transparency in nursing home spending. I think this is a good first step. It's going to give us a sliver of spending, how much these nursing homes spend on direct care. This information needs to be posted publicly, so researchers and other folks can look at it. But it's not going to get us the type of transparency we really need, the full picture. Well, if you're not spending it on this, what are you spending it on? And that this rule doesn't require that. So it's going to give us kind of a glimmer, right? A little kind of you're opening the door a little when we really hoped that they would open it wider. But more data, the better. Maybe it's an important first step to more transparency down the road.
So I think those are the main provisions that we wanted to talk about today with respect to what's in the rule. Consumer Voice has already put out a summary, and we've done a webinar on what's covered in the rule. We're working on some additional opportunities to educate consumers and advocates about not only what the rule means and how it can be used, but also what are some of the advocacy points. And we touched on a couple of those today. But stay tuned to us for more information about, how this rule will affect you, how you can advocate for better staffing in your nursing homes. I think we'd be remiss to point out that there continue to be significant challenges to implementation of this rule. And the nursing home industry continues to fight very hard to stop implementation. Sam mentioned a lawsuit that's been filed to stop implementation, and there are some bills pending in Congress right now to try to stop implementation as well. So those of you listening, you may see action alerts from us, which is asking you to weigh in and tell your policymakers, your members of Congress, how important it is that this rule go into effect. As Sam mentioned, this is a very important step forward in getting to achieving necessary staffing and quality care for every resident in a nursing home. And we need to keep moving forward and not go backwards. So with that, Sam, anything more you wanted to share?
I echo that. The nursing home industry is spending millions of Medicare and Medicaid dollars that they get to oppose this. And they have an office in every district, and they are talking to members of Congress every day. We need to push back. Your voice does matter. When your member of Congress hears this and hears you reaching out, it does matter. Don't think it doesn't. So the more you can speak out in favor of this, and remember, this is about nursing home residents. It's not about nursing home owners. I think that's absolutely right. We need your help in this battle. And the fight continues.
And certainly, certainly not only indicate your support, but tell your stories of how inadequate staffing in nursing home has affected you or your loved one. That's really what is going to help push this and keep it moving forward. So thanks so much, Sam. Always great to chat with you, and stay tuned, all of you, for more information from us. You can go to our website and follow us for more information and resources that we'll be developing on this issue, as well as to access the summary that we've already prepared or listen to the webinar that we did about 2 weeks ago. So you can get our website at www.theconsumervoice.org. And with that, we'll close for the day. And Sam, talk to you later.
Thank you so much.
Thanks.
Bye, everybody.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on Facebook and Twitter, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.